and gentlemen, welcome to press briefing of the State Council Joint Prevention and Control Mechanism. Since October, for 4 weeks, the number of COVID-19 cases has picked up. And now China is keen to contain the number of cases that is from overseas and to cut the chain of transmission. And now the cases have been spread across over 20 provinces in China. So we are facing a very challenging situation. So we are keen to contain the cases from both at home and also from overseas, and to make sure that the cases are put out, and also to contain not only the cases but also the environment, and to ensure that the people receive regular tests. And we are keen to implement the responsibility at community level, and we implemented classified treatment of the containment system. As of the 5th of November, 2.3 billion doses of COVID-19 vaccines have been accepted, which benefited over 10 million people. So today we're going to give you the latest information on the prevention situation. We have now delegates from the Ministry of Transportation and also the National Immigration Office, and also the Director General Liu Haitao from the Immigration Office, and also the Civil Aviation Administration of China, and also the Chinese Disease Control Center from China. So these honorable guests will take questions from the floor later. And now the floor is open for questions. Please identify yourself first. Now the first question from CMG. Just now you mentioned that the epidemic has swept over 20 provinces in China. Can you give us the latest information and how this epidemic is going to develop in the future? I'd like to give the floor to Director General Wu Liangyou. Thank you for your question. Lately, the epidemic prevention and control has received a nationwide attention from the country. As this host has said, since October until the 5th of November, we have reported 918 cases in China's mainland, and 44 regions have been affected. According to the region tracing and other research, we have identified cases from overseas with related or unrelated links. According to the plan of the State Council, we are keen to implement our responsibility and translate the responsibility into actions. Now, Shanxi, Hubei, and Hunan and other provinces have reported no new COVID-19 cases for over 10 days. That means we have put the epidemic under full control within a short time. And lately, there has been some scattered cases in Jiangsu province, but it has reported no community-level transmission. Shandong, Guizhou, and other provinces have been introducing the prevention measures, and the measures are taking effects. Gansu and Qinghai and Ningxia and Yunnan and related regions have reported epidemic vibration, but it's at a slight level. Heilongjiang, Hebei, Henan, and Jiangxi, Sichuan, and Chongqing, and Liaoning, including Dalian and other regions. In these areas, the epidemic is still developing. We need to followed the epidemic situation closely in these regions. Well, the epidemic has been transmitting very fast and also spreading to a large scope. That means we are facing severe challenges both at home and at different levels. The central government is watching closely the developments in these regions, and we are keen to take actions to implement the guidelines from the joint prevention and control measures. And we have carried out epidemiological research analysis and step up the management of the isolation spots and medical institutions to decrease the risks of transmission and also to ensure all the related policies and measures are fully implemented so that the situation will be under full control. Thank you. Well, another question from the floor. Thank you for this opportunity from CGTN. According to some related reports that we are enlarging the scope of vaccination. So can you give us more related information in this regard, especially the vaccination of the children? Can you give us some latest data and also theory and also conclusion from the clinical research? So Mr. Wang will answer your question. We have started vaccination efforts for the 3 children aged between 3 and 11 years old. Well, the disease rate of children actually is quite not low. Especially in some countries, there has been some consistent transmission. And this has led to the rising number of infected cases among children. And there has been some severe cases. So judging from the situation, there has been some reports on the severe cases and also fatality rate among the children. And the hospitalization rate has increased by 10-folds compared with this year earlier. Once the children got affected, it will be more challenging to manage the children because if the children are kept in the kindergarten or at school, in other institutions, this might be a higher risk of contacts and crowded transmission. Another point is that we hope the vaccination will play a greater role in facilitating the community immunization. For the children, the immunization is very important. So the vaccination for the children is very important towards the herd immunity. You asked a question about the clinical research. In China, the vaccination experiment has showed quite a high level of immunity. Especially the inactivated vaccines have proved very effective. The approved vaccination of the inactivated vaccines for the children have proved no higher than the adults. In China and also in some countries, we have entered a phase 3 clinical trial. So this has generated some acceptable results. The floor is open for more questions. Many thanks. I'm from the Transportation Daily. We noticed that in Urgency, has reported some cases of the drivers who are involved in the cross-border transportation. So what kind of difficulties or challenges are there in terms of the prevention control of the cases in this regard? Now, Mr. Zhou will take your question. This round of epidemic, including the cases you referred to in Urchnachi and also the Heihe River and also Lianhao-Ter and also some cities in Yunnan province, they have showed something common, and the situation is still severe and is not being put under full control. Now, 192 canal points have been opened for water transportation in China. So they are facing some new pressure. On the one hand, they have to keep the transportation smooth, and also, on the other hand, they have to fight against the COVID-19 epidemic. So we face the dual pressure of transportation and prevention control of the epidemic. So we have 4 measures. First is to ensure effective control of the canal points. We have compiled relevant guidelines. We have published 6 documents, and these documents are being under amendment. We have published the 8th edition of the Prevention and Control Measure Guideline, and we are editing another edition for the Prevention Control Handbook. And this is crucial to guide the effective and scientific management of the transportation industry. We need to ensure that there is a closed link control of the situation. This has affected 130,000 places. And we ensured all related people receive the vaccination. Secondly, we ensured strengthened efforts of prevention and control in key areas. We carried out non-contact way of work for the transportation areas, and we stepped up the disinfection and waste treatment of the transportation sites and ensure that all places are disinfected. We also put in place a mobilization system for the transportation sites. And also we exercised remote control of the transportation sites. We worked together with Russia, Kazakhstan, and Mongolia. We worked with our counterparts in these countries, especially the transportation departments, to step up the monitoring and control of the drivers and also transportation sites. Last but not least, we stepped up the guarantee and the supply for the transportation sites. We carried out non-contact transportation and streamlined the work methods and ensured both safety and efficiency in these areas so that the import and export of cargo in China will be implemented smoothly. We noticed there may be difficulties in this process, but we are doing our best to safeguard the steady progress of the international logistical chain. Another question from the floor. Thank you for giving this opportunity. Now the epidemic level in both China and the world is quite high. The airport is an important area for controlling the epidemic. Can you give us some information about this area? Well, thank you for your question. The international situation of fighting COVID-19 is still quite severe, and the airports are the main battlefield for fighting the disease. The General Office of the State Council, State Council Joint Prevention Control Mechanism is keen to implement the measure, to publish the measures. We published the guidelines to step up the prevention and control measures of both the people, the places, and the tools. In terms of protecting the people, we stepped up the protective measures for the work staff in the airport. We separate the work staff and also the places. We separate the people from the workplaces, and also we separate people from the facilities. We also strengthened the testing facilities. We also imposed stricter requirements for the nucleic acid testing for the people who newly landed in China. So one testing is required for each day, and we are keen to make this a normal mechanism and a daily process. And we also carried out the trainings towards the staff at the airport. And also we carry out some maneuvers for the people so that they can be more protective and better prepared against the COVID-19. We also exercise the control of the cold chains and non-cold chains, and also the transfer and storage of the cargoes. And also we implemented classified treatment of the cargoes. Another measure is to strengthen the disinfection of the places, including the parcels and the cargoes, and also the factories. We use the spray to disinfect the interior of the factories. And also samples are selected for nucleic acid testing. We make strict control of the airport section by section. We also have a special emergency isolation area in the airport. We also strengthen the ventilation in the airport so that the passengers will be safe. And also we asked the passengers to report their health code to ensure that they held a green code. We also carried out disinfection of the interior of the airport, including the bridges and the corridors. Thank you. The floor is open for more questions. Thank you. I'm from the front page news. The epidemic situation in China and the world is quite severe, and we are facing mounting pressure. So what kind of measures will be implemented during the Spring Festival travel period? Director General Liu will answer your question. Thank you for your question. As the temperature decreases in the winter season, the epidemic is continuing to threat our people, and we are facing mounting pressure in this regard. Especially the border areas, we are facing severe challenges and a complicated situation. The Immigration Bureau of China is keen to control the import and export of the cases, and we are following closely the new characteristics and new features of the disease, and we are taking actions accordingly. First, we take detailed measures to supervise the workplaces. For these areas that enter the frozen period, we will step up the monitoring and control of the workplaces in a timely manner and in a sustained manner. And we will ensure that no illegal people will pass the border. And we have stepped up the administration of the border areas to make sure that no illegal people will cross the border and to bring in the threat of the COVID-19 cases. We also carried out evaluation of the COVID-19 in these areas and stepped up the control of the people flow in these areas. And second measure is to take stricter measures to take up classified monitoring of the border areas. In the winter season, the people may travel more, and there may be more traffic. So we are keen to step up monitoring efforts so that both the people and the workplaces are monitored and they will receive the closed chain management. We also have management section by section so that the work staff and the passengers are separated. The cargo service and the passenger service are separated so that no cross-secting infection will happen. And we will ensure that the people are kept away from the workplaces that might be the key areas for COVID-19 transmission. We also implemented a digital service in these border areas. And for the small ships and the small fishing boats, we are keen to step up the monitoring service. In the land areas, we have worked with several departments to separate the people traffic and the vehicle traffic so that and we also implemented a no contact examination of the people so that the prevention and control will be carried out in a coordinated way and the process may be streamlined and better improved so that the international logistical service will be carried out in a safe manner. Third, we will step up the safety efforts. In the winter season, the disease may stay longer and the risk may be higher. So we will closely watch the high-risk areas, especially in the high-risk areas. The people need to be monitored from the workplace to homes. Once they're in duty, they will be disinfected. They will be vaccinated. They will receive the trainings for preventing the transmission. And they will hold the badges or the access badges to the workplaces. So we will ensure the one is disinfection for one time of duty and one disinfection for each day. So these are the measures we have taken to ensure effective control of the epidemic situation. Thank you.
I'd like to ask a longer-term question about the zero-tolerance policy.
Another question from the floor.
At preventing a lot of cases in China, but has also caused a lot of inconvenience for people and some economic issues as well. What are the criteria or conditions are you thinking at this point that need to be met in order to end the zero-tolerance policy and allow more freedom of movement and the economy?
好，请翻译一下问题。
来自美联社的记者，我有一个偏向于长期的问题。我知道中国的零容忍政策有效地抑制了、遏制了疫情的传播，但是也 会对于人员的流动造成多有不便，也会在某种程度上限制一些经济的发展。那么在什么样的标准和条件下，中国有没有可能考虑会或放弃或停止零容忍的政策，以便促进人员的自由流动？谢谢。
好，我们请吴良友先生来回答这个问题。
谢谢您的提问。1年多来啊，我们始终坚持将人民至上、生命至上作为疫情防控工作的根本出发点。
Director General Wu Liangyu will answer your question. Thank you for your question. For the past year, we have been putting the people's life and people's interests at first. And this is our fundamental rule in doing our work. We are keen to control the cases from overseas and also the transmission of China's cases to the world. And we have carried out emergency plans for regional cases and also the cases at country level. Since the outbreak of the first case in Wuhan in China last year, we have reported 30 rounds of epidemic. For each time, we have been able to put the epidemic under full control with precise treatment. We did everything to cut the transmission route of the epidemic and ensure that China reported a steady situation of epidemic. So the general policy is to ensure no cases from China go to the world, and there is no new cases from the world to China. So we made coordinated efforts to ensure both the economic development and also the prevention and control of the epidemic. Lately, there has been some new developments in both China and the rest of the world. The prevention and control situation is still challenging. We must take strict measures to make sure that no new cases will be transmitted to China and also the vice versa. Thank you. The floor is open for more questions. I'm from Xinhua News Agency. According to the epidemiological research survey, this round of epidemic is rooted from the border areas and also from the ports. So what do you think of this situation? Mr. Wu Liangyu will take your question. Well, thank you for your question. I mentioned just now that the international situation for the epidemic control is still severe. And China is facing mounting pressure of containing the situation both at home and also the cases from overseas. We have played an important role in putting the epidemic under full control. The CPC Party Central Committee of China attaches great importance to this area and stress that we must coordinate both the fight against the epidemic and also the economic development. We must coordinate the customs, the transportation, the business, and all related areas across the provinces and the regions. We must ensure Heihe River and Erjina that in these areas, the epidemic efforts will be put into place. We must solve the emergent issues in these areas. In the next steps, we will continue to work under the guidance of the State Council Office for the Joint Prevention and Control Mechanism to give more support to these regions, and we will monitor the process for implementing the measures for prevention and control so that the measures will be implemented at a more strict level. First, we will ensure that the land areas, the people will be separated from the cargo, and there will be closed treatment of the passengers and the cargo, so that the materials and the people and the workplaces will be separated, so that the policies and measures will cover each place of the regions. And we will ensure that the cargo will be discharged and uploaded at designated spots. For the staff working at these places, they will receive more strict measures. And we will impose stricter policies against the imported cargo. And we will take out more strict disinfection and monitoring measures, so that we will cut the transmission routes of the disease. We will fully implement the chief accountability mechanism at the community level. We will strengthen the construction of the fever clinics and step up the management of these workplaces. And we will also ensure that the nucleic acid testing sites will be strictly under monitoring. And for the tourist attractions, we will ask people to follow the instructions for registration. And once a problem is detected, we will shut down the place at the first time. And also, we will implement stricter measures for the staff working in the tourist attractions. Judging from the situation of this round of epidemic, the offline meetings and the tourism have been the cause of the development of the disease this time. So we will try to downsize. We will ask the people in hosting, the host and organizer of these conferences, to take responsibility for whatever will happen. And for those conferences, we encourage the offline. We encourage them to be held online instead of offline. During the epidemic period, we encourage less tourism and outdoor activities. For the weddings and other gatherings, we encourage them to be downsized. We hope everyone will make a contribution to the prevention and control of the disease. Thank you. From the Financial Center of the China, from CMG. Now, there has been a augmented vaccination. So if someone got vaccinated from a certain brand, for example, the mRNA from other countries, can we still have access to the vaccination of this dose? Director General Wang will answer your question. You mentioned 4 vaccines in your questions. Actually, these 4 vaccines cover a large group of people. And these vaccines have been approved for going to market by the Chinese government. And why do we choose to give an augmented vaccination based on these 4 vaccinations? Because this is based on scientific data and on the technical route. According to our survey, there has been over 7 billion doses of vaccines that have been taken by our people. So the booster injection is for the purpose of strengthening the immunity. You mentioned the inactivated vaccination and also mRNA vaccination. We are considering to cover these areas according to our further study and also the vaccination supply. So we will study the situation and see if people who got vaccinated to the brands you mentioned will be covered for the booster injection. The floor is open for more questions. Thank you from Hong Kong Economic Daily. My question goes to Director General Liu Haitao. Lately, the Immigration Bureau of China has been cracking down on illegal immigration in China. So, against the epidemic, will you take even more strict measures? Thank you. Director General Liu, the floor is yours. Well, thank you for your question. For the illegal immigration and also the illegal transmission of the diseases, the National Immigration Office has been taking strict measures to crack down on these actions. This year, we have identified 14,900 illegal cases. And we have brought 35,000 illegal people into justice. And 36,900 people have been identified as illegal people. So after these efforts, the whole environment for immigration has been made better. So for this winter and next spring, we are closely following the situation. And we will crack down on the misconducts. And we will relentlessly shut down the routes for misconducts. First, we will monitor and track the criminals suspect at large. And we will make sure that the major criminal that is at large will be kept under, will be brought into the justice of law. And we will set up a dynamic monitoring service for the illegal immigration, transportation, storage, or those who take illegal taxis. We will strictly crack down on those who hide in the job market at the border areas and those who hinder the market activities. We will crack down and punish those who destroy the facilities and open up illegal channels, and also who commit other misconducts. So this may pose danger and threat to the epidemic prevention and control, but we will make sure that this will be put under full control. Thank you. Thank you. I'm from the first economic daily in China. Now Chinese government has initiated the booster injection, and this is it's targeting the people who have passed the 6 months after receiving the second injection. So thank you for your question. Well, for the receiving a booster injection, you need to make sure that 6 months has passed after receiving the second dose. Well, this time period is a result of conclusion drawn by the experts, and following the immunity process. If the time period is more than 6 months, the result or impact of the dose is it will not be infected. But if the period is prolonged even longer, there might be some slight difference. So we kindly encourage everyone to strictly follow the suggested time period to receive the booster injection. According to our scientific data, we will continue to improve our policy recommendations, and the 6 months period is the latest result and our latest suggestion for the moment. And so we kindly encourage you to follow the instructions. Thank you. I'm from Phoenix TV. There has been reports of new cases, especially the travel history of the ports have been detected in the cases. So what kind of immunity measures have been taken out in these people? Director General Wu Liangyu will answer your question. Thank you for your question. According to the plan of the Joint Prevention and Control Mechanism of the State Council, we have stepped up the immunity service, especially the vaccination work. We have identified the key groups of people who are to receive the services, especially people who work in the airports and the ports, especially people who aged over 65, and also people who work in the key posts. Aside from these people, and the departments and authorities can make your own judgment, and you can decide on your own to enlarge the group of vaccination. And you can decide to give a stronger immunity service to your people at your own discretion. 37 million people have been vaccinated at community service lately. And we have mapped out a detailed work plan and to ensure that each region will take up its own responsibility for the prevention and control of the epidemic. And each industry will have its own instructions for the epidemic prevention and control. For the high-risk areas and for the immunity efforts will be carried out by the regions, will be carried out by the locality. And these areas are asked to follow the instructions accordingly, strictly, so that people will be kept safe. The last question. Thank you from Hongxin News. Now, the epidemic situation outside China is still severe. So in China, also the situation is quite challenging. So what the Ministry of Transportation, what measures has the ministry taken? to ensure the safety of the people. Director General Zhou will answer your question. Thank you for your question. Transportation is one major route of the air transportation is one important way of transportation. President Xi Jinping also gave a congratulatory message during the latest 2021 International Conference of Transportation. And he remarked that air transportation is an important way of connecting the people across the world. And air transportation has played an important role in the steady progress of the economic performance and also ensuring the safety of the people. It is a key force of ensuring the smooth flow of the people. The epidemic has changed the ways of people's life. China attaches importance to the safety and interests of the people. Since the outbreak in 2020, the Ministry of Transportation has taken various measures to ensure the safety, the health, and also legal, legitimate rights of the people. We have published a guidebook. It has been the 7th edition has been updated, and this is very useful for the people who work in the industry. Another measure is to implement the responsibility as the major player. We also ensured that the materials and supply are put in place in the ship so that the staff needs are met. Thirdly, we worked with the local governments and institutions to provide better service to the staff for receiving vaccination. Since April last year, 310,000 people have took duty shifts. We have done everything to ensure the safety and health of the staff. And we worked with the customs, the immigration office, and the health sector to respond to the needs for changing shifts of the staff, so that those whose health is in threat will be protected. One last question. I'm from Hong Kong and China Comment Media. We noticed that you published the 8th edition of the Prevention Control Measures Guidebook in China. This is quite what kind of new measures have been introduced in this guidebook? Can you tell us the latest? Can you give us the latest update? Thank you for the question. Also, thank you for your interest in our work. We followed the characteristics of the developments of the epidemic. We published the 8th edition of the guidebook, and we have included the detailed instructions, including people getting on board and getting off board. Today, I will give you some key measures in the flight air companies. The first measure is to scan the code to show the health code, and also to put in place a section-by-section service. And also the disinfection is put in place to ensure the health of the workplace of the people, and also the safety of the workplace. Since this year, the Civil Air Administration has shut down 212 air flights. And we have taken more precise and more dynamic monitoring service across the flights. and we have put forward more strict measures for the flight companies. Second, for the cities that the airplane started from, the rear parts, the last 3 rows in the rear part of the plane will be reserved for emergency seats, so that once fever is detected in the passengers, they were brought to the emergency seats for treatment. Now in China, we still have some spotted cases. So we kindly remind the passengers to double-check the prevention control policies in the destination, and to wash hands often, and also disinfect often, and also to have your temperatures taken, and also to show your QR code. Also, according to, and you must follow the guidelines and instructions of the airport staff, and also the crew. I think this is a joint effort. We rely on the efforts of all to create a harmonious environment for air traffic. Well, thank you, everyone. We have introduced the latest policies for the joint prevention and control of the COVID-19.